Diagnostic labels, making a diagnosis. When is it appropriate and when is it not so appropriate? What are the pros and cons? Coming right up. Hey, I'm Dr. Ekberg with Wellness for Life, and if you'd like to truly master health by understanding how the body really works, make sure that you subscribe and hit that notification bell so that you don't miss anything. So diagnoses are based on symptoms and signs. So you present to the doctor and you tell them what's bothering you. You have a rash here and you have a headache and you have a pain here, and they put it all together and they say you have this. That's making a diagnosis. And when is that appropriate? Because that's what our entire healthcare system is based on. It's making a diagnosis and finding the appropriate treatment. But diagnoses are based on signs and symptoms. Symptoms are the things that you tell the doctor, and signs are the things that they find, such as high blood pressure and so forth. But symptoms can be due to either trauma or they can be due to functional factors. So functional factors, those are things that your body regulates, things that your body turn on and off, that your body turn up and down, such as stomach acid and blood pressure and blood sugar and pH and hormone production. All of those things are managed on a second-to-second basis by your autonomic nervous system. That's called regulation. It regulates your physiology. And if there's an imbalance in one of those, then you have a functional problem. So that's where it's not due to a trauma, but it's something that is functional. Trauma obviously is an accident. It's something that happened. You fell down the stairs, you're in a car accident, something happened. So here, the diagnosis would be in a trauma would be that you're bleeding. You're bleeding from your abdomen. You're bleeding from your arm or something like that. Then they want to sew it up and fix it. You could have a fracture. You could have a fracture to any bone in the body, and they make a diagnosis. They figure out where it is. They treat it. They set it. They give you a cast, and they allow time to heal. Burns is another form of trauma. So in all these cases, it is very, very appropriate to make a diagnosis. It's critical to make an appropriate diagnosis so that you can treat the signs and symptoms as fast as possible and save lives. On the functional side, we can have two categories. So something cannot work for a long, long time and give rise to a crisis. And now this is something life-threatening. That could be something like appendicitis, could be a stroke, a heart attack, a diabetic coma. And once again, it is critical to make an accurate diagnosis and to treat the correct condition. And we treat the signs and the symptoms and we save lives. So here, drugs and surgery and emergency or crisis intervention is absolutely critical, and it helps save lives every day, millions. If the functional problem is a chronic one and not life-threatening, then it is not so valuable to make a diagnosis, because these are things like heartburn and headaches, insomnia, fatigue, ADD, high blood pressure, hypothyroid, and the list goes on and on and on and on. And if you open up, I don't recommend this, but if you open up the Merck manual where they have the 50,000 different diagnostic conditions and labels, you'll find that 99% of them are in this category. These are lifestyle problems. These are imbalances. And what we have to understand here is that these things are not the problem. These are the result of an imbalance, and if we treat the symptom, we allow the imbalance to continue. And if we allow something to continue, it will get worse every time. So here it's very, very appropriate to treat the condition and to treat the symptom, but here the symptom is not what it seems to be. It is because of something else. The heartburn could be due to 100 different things. It could be stress, could be low pituitary, could be a slow thyroid, could be eating the wrong kinds of foods. So unless we address those things and we just treat the heartburn, we are allowing the problem to get worse. And as a matter of fact, once we treat symptoms in this category, we are actually doing something dangerous. This may be one of the worst things that humans have ever come up with, because once we treat this and allow the problem to get worse, this is what accounts for most of our suffering. Like I said, 99% or so, the things that we suffer from are in this category. And when we treat the symptoms, we allow the underlying imbalance, we allow the underlying problem to get worse. The only thing to make this better long term is to listen to the body and to restore the health. So it's not about right or wrong, it's knowing when do we need to do one or the other. And we need to understand that the thing called health care is not really about health care. The thing that most people, that most of our society's money is spent on, is actually treating this with drugs and surgery when it's completely inappropriate, and this is a very, very small portion. So the thing to remember is that this is crisis intervention. This is where medical care is very, very appropriate. This is where you need true health care. And the medical system has nothing to offer in this area because drugs and surgery will never make anything work better. They can save a life, but they cannot restore health. So when we talk about health, there is only one goal in healthcare, and that is to return the body to normal. When we return the body to normal, it will handle, it will fix, it will correct all of these things unless it is just too far gone. So the value of diagnostic labels is when there is a condition that needs, where it's appropriate to treat the symptom, such as a trauma or a crisis. When it's very, very inappropriate, when it's either useless or dangerous, is when we have a chronic functional condition and we apply a label and we try to treat the label. Then that is counterproductive and it is harmful. So I hope this has been helpful. If you enjoy this kind of information and you're new to this channel, make sure that you subscribe and hit that notification bell so that we can keep this content coming to you. And please share this information, because we are spending $3 trillion a year on applying the wrong kinds of treatments. We need health care in this country. We need to help people understand how to restore bodies to normal. Thanks for watching.